Welcome to today's video lecture. Today, we're going to delve into a fascinating topic, deep venous thrombosis. Before we start, don't forget to check out our website, madeformedical.com, for hundreds of more videos like this at the end of this video. The link is in the description. In this session, we will delve into deep venous thrombosis, including its definition, etiology, pathophysiology, clinical presentation, diagnostic approaches, and management strategies. By the end of this lecture, you will have a comprehensive understanding of deep venous thrombosis and its impact on patient care. So, let's begin. Let's start with what is deep venous thrombosis. Deep venous thrombosis refers to the formation of a blood clot or thrombus within a deep vein, most commonly in the legs. The clot can partially or completely obstruct the blood flow, potentially leading to serious complications such as pulmonary embolism. The primary cause of deep venous thrombosis is a condition called Virchow's triad, which consists of three factors that increase the risk of blood clot formation. These factors are venous stasis. Reduced blood flow or stagnation within the veins can promote the formation of blood clots. Venous stasis can occur due to immobility, prolonged sitting or bed rest, obesity, or conditions that affect the natural pumping action of the muscles, such as paralysis. Hypercoagulability, increased blood clotting tendency, or abnormal blood coagulation factors can predispose individuals to DVT. Hypercoagulability can be caused by genetic factors, certain medical conditions, e.g., inherited thrombophilias, hormonal changes, e.g., pregnancy, oral contraceptive use, or certain medications. Endothelial injury, damage to the inner lining of the blood vessels, called the endothelium, can trigger the formation of blood clots. Injuries can occur due to trauma, surgery, inflammation, or underlying conditions such as vasculitis. Deep venous thrombosis may present with a range of signs and symptoms, but it is important to note that some individuals may be asymptomatic. Common signs and symptoms include swelling, warmth, and tenderness in the affected leg, pain or discomfort that may worsen with walking or standing, redness or discoloration of the skin over the affected area, visible veins or superficial venous dilation. In some cases, the clot can dislodge and travel to the lungs, causing symptoms of pulmonary embolism, such as sudden shortness of breath, chest pain, or coughing up blood. The pathophysiology of deep venous thrombosis involves the formation of a blood clot within a deep vein. When venous stasis, hypercoagulability, or endothelial injury is present, it can disrupt the balance of factors that prevent excessive clotting, leading to the formation of a thrombus. The clot typically starts as a small fibrin clot that gradually enlarges, incorporating red blood cells, platelets, and additional fibrin strands. This clot can partially or completely obstruct the vein, impeding blood flow and causing local inflammation. Diagnosing deep venous thrombosis involves a combination of clinical assessment, medical history, and diagnostic tests to confirm the presence of a blood clot and assess its extent. Common diagnostic approaches include physical examination. A healthcare provider may assess the affected leg for signs of swelling, warmth, tenderness, or visible veins. They will also evaluate the patient's overall medical history and risk factors. Doppler ultrasound. This non-invasive imaging technique uses sound waves to create images of the blood flow in the veins. It can detect the presence of a blood clot and determine its location and size. D-dimer test, a blood test that measures a specific substance called D-dimer, which is released when a blood clot breaks down. A positive D-dimer result indicates the presence of clotting activity, but further testing is needed to confirm the diagnosis. Venography or CT venography. In some cases, an invasive procedure called venography or a CT scan with contrast may be performed to provide detailed images of the veins and identify any obstructions. The management of deep venous thrombosis aims to prevent the clot from growing larger, reduce the risk of complications, and prevent the formation of new blood clots. Common treatment approaches include anticoagulant medications. These medications, such as heparin and warfarin, help prevent the further growth of blood clots and reduce the risk of new clots forming. They thin the blood and promote its ability to flow freely. Compression stockings. Wearing compression stockings can help reduce swelling, promote blood flow, and prevent the formation of new clots. Thrombolytic therapy. In more severe cases, thrombolytic therapy may be considered to dissolve the clot quickly. This treatment is usually reserved for individuals with extensive clot burden or those at high risk of complications. Inferior vena cava, IVC, filter. In certain situations, an IVC filter may be inserted to catch and prevent blood clots from reaching the lungs, particularly in individuals who cannot take anticoagulant medications or have recurrent clots despite treatment. In conclusion, deep venous thrombosis is a serious condition that can lead to significant health complications if left untreated. It is essential to recognize the signs and symptoms, especially in individuals at higher risk, and seek prompt medical attention. Early diagnosis and appropriate management are crucial to prevent the clot from growing, reduce the risk of complications such as pulmonary embolism, and promote overall well-being. For more videos like this, please subscribe to our YouTube channel and visit our website madeformedical.com. Link is in the description. Thank you.